Hey guys, it's Dr. Dadvand here, board certified plastic surgeon here in Los Angeles, and welcome back to my YouTube channel. So my channel is dedicated to plastic surgery of the breast and body with a specific focus on gynecomastia and FTM top surgery. So I post a lot of videos about the surgical treatment of gynecomastia, but today I want to do something a little bit different, and that's to talk about different non-surgical options for gynecomastia. And I also want to give them a rating of 0 to 5 as far as how useful they are as far as treating the gynecomastia non-surgically. So the first one I want to talk about as far as non-surgical ways of treating gynecomastia are estrogen blockers or aromatase inhibitors. They're two different categories, but they do similar things. And so really the problem with gynecomastia is people either have too little testosterone or too much estrogen, and that stimulates the breast tissue. So estrogen blockers can sometimes work, but it's really important to know when to use them. They have to be used pretty early on in the development of gynecomastia. So usually guys who have gyno that's been there for years and years, estrogen blockers aren't going to work. And so if someone has had gynecomastia for a few months, it's really early on and they've got some symptoms of pain, estrogen blockers can help with the pain, but it can also start shrinking the breast tissue down. Now, it also has some side effects that are really serious too, and so you can't be on these medications for long term because if you have too little estrogen in your body, you can have issues with osteoporosis, with heart disease, with mood disorders, and also sexual dysfunction. So the Dr. Dadvand rating for estrogen blockers is a 2.5 out of 5. So the next one I want to talk about is COOLSCULPTING. So COOLSCULPTING is basically a non-invasive way to get rid of fat. The way it works is you put these probes on the skin and it lowers down the body temperature in that area, and what happens is the fat cells crystallize and then they shatter. The body then digests it and gets rid of it, and it gets rid of the fat that way. For true gynecomastia, that's not going to work. And the reason is because real gynecomastia is having too much breast tissue, not having too much fatty tissue. But there is a condition called pseudogynecomastia, and that's where the body has too much fatty tissue in the chest, usually in heavier guys, and COOLSCULPTING may have some benefit for that condition. But let me talk to you guys about something called PAH, or paradoxical adipose hyperplasia. It's a not common occurrence with COOLSCULPTING, but it does happen about 1 in 3,000 cases. And what it means is you do the COOLSCULPTING treatment, but instead of getting fat to go down, the body actually responds entirely opposite and creates more fat, and the area gets fuller. There's some pretty famous cases out there, one in particular that you may have come across online about a certain model that's had this experience. So the Dr. Dadvand rating for COOLSCULPTING for true gynecomastia is a 0 out of 5. So the third non-surgical treatment for gynecomastia that comes up a lot is natural remedies, such as milk thistle or turmeric. How do these things work? Well, it's a little bit vague, but turmeric might have some association with developing the body's ability to produce more testosterone. And really with gynecomastia, the issue is not having enough testosterone or having too much estrogen. So taking turmeric may potentially stimulate the body's ability to create more testosterone, but to the level that it could actually reverse gynecomastia, I think that's going to be a no. And then milk thistle, it's really more for people who have issues with their liver, and the job of the liver is to basically absorb estrogen out from the bloodstream, and so if your liver's not working right, you have a buildup of estrogen. Again, if you don't have any liver issues, then milk thistle's not going to really work. So natural remedies overall aren't really going to be a great treatment for gynecomastia. So the Dr. Dadvand rating for natural remedies is a 0 out of 5. So the general take-home message from this video is that non-surgical treatments for gynecomastia generally don't work, and the only predictable way to fix gynecomastia is surgery. So I hope you found this video helpful, and if you want more information on all topics gynecomastia, check out my Instagram page, my TikTok page, and of course my YouTube channel. Till next time, guys.